Be a bright spot. You never know when a smile, compliment, or kind word can change a person's day.
Good afternoon and welcome to Bright Spot, a virtual discussion bringing you a dose of inspiration while normalizing conversations about mental health and substance use disorders. This show is presented by CNS Healthcare. My name is Kara Johnson. I am your guest host today, your marketing and outreach manager for CNS Healthcare. We want everyone to know your mental health matters, and it's okay to not be okay. Today's guest is Cate Spinney, Program Director for CNS Healthcare, who will be talking about substance use services. Cate, please tell us a little bit about yourself, and let's dive right in.
Hi, my name is Cate Spinney. I am a Program Director, as Kara said, for CNS Healthcare. I primarily work with our children and family programs within Wayne, Oakland, and Macomb County. I am a graduate from Michigan State University, go Green, and my background is in social work.
Cate, can you tell us a little bit about substance use disorder services at CNS Healthcare? What's our approach? How does that look? Fill us in a little bit.
Yeah, absolutely. While CNS Healthcare is not a primary SUD provider, meaning that we don't provide services to individuals who have SUD as their primary diagnosis, we have a plethora of other programming and support services for individuals who have substance use disorders. We have a comprehensive medication-assisted treatment program. With the exception of methadone, we are able to provide any and all medication-assisted treatment to individuals and are very lucky to have the majority of our clinical staff, our physician assistants, our nurse practitioners, and our physicians and psychiatrists that have their MAT waiver through the state of Michigan that allows them to prescribe medication-assisted treatment to support. We also have co-occurring diagnoses or disorder diagnosis support across all of our programming and try to, in every way possible, support the substance use community, people who are in recovery from addiction, and people who are preparing to enter recovery, still struggling with substance use, to make those preparation steps and really take that next step into recovery. So we have case management, we have therapy, we have supported employment and other resources to support recovery and really the recovery-oriented systems of care for individuals.
That's very helpful, Cate. Thank you. Can we dive in a little bit more on a couple terms that you brought up that I want to make sure our audience understands? Medication-assisted treatment and then co-occurring disorders. Can you talk about what both of those are and what that looks like?
Absolutely. I apologize for letting the acronyms and the key terms get away from me. But
no, you're all good.
And I understand it can get kind of confusing because there's a lot of acronyms, there's a lot of industry-specific terms that get thrown around, and it's hard to stop and say, hey, I don't know what that means, or I don't understand. So that is something that's really critical when you're coming into treatment for anybody out there that is considering starting their treatment journey or their recovery journey. Being able to just say, hey, hang on a second, I have questions is really important. So just an aside. When co-occurring is being used, it means that there's more than one diagnosis. The co-occurring piece typically indicates that you have a mental health diagnosis, depression, anxiety, ADHD, OCD. I'm throwing around more acronyms. There you go. But, if they have any kind of diagnosis along the mental health spectrum in combination with or co-occurring with a substance use diagnosis. This also could be true for an intellectual and or developmental diagnosis like cognitive impairment or autism or things of that nature. Does that answer the question?
Yes, absolutely.
So. Okay.
And what about medication-assisted treatment? Can you take us through the goals of that or what that looks like to somebody who is in recovery?
Absolutely. So medication-assisted treatment is a wonderful option of support for recovery. and it essentially entails a medication that you would take to decrease your overall cravings and or the desire to use alcohol or other drugs. It's typically used in support of alcohol dependence and or opioid dependence. And so what you could be looking at is a daily pill or dose. Methadone comes in a small cup that you would take on a daily basis. Suboxone is a pill, and those support opioid dependence. And Vivitrol and or Sublocade are two different options for injectable medications. And overall, medication-assisted treatment is really meant to support that person's recovery. There are lots of different approaches or methodology to medication-assisted treatment, and sometimes people take them temporarily to be able to help bridge and start that recovery journey, and other times people use it more long-term and or indefinitely. And all of those options are in the spirit of what we call harm reduction. And that just means that what we are doing is in the spirit of or in the effort of reducing that person's risk-taking behaviors and improving, even in small steps, their overall outcomes.
Appreciate you taking that step back with us, Cate. I know that's very helpful for everybody who's watching at home right now and may not be a clinician with all the, speaking of acronyms, acronyms behind their name like you are. No, not at all. When thinking about people receiving substance use disorder treatment, you talked about, the stages that when people are ready to do that. What do you see as the biggest barriers to people starting their recovery journey?
That's a really great question. And it's pretty nuanced because it really depends on the individual. And what you're referring to, I think, is really important to kind of frame it with stages of change, is what we call it in, the substance use or addiction treatment community. And it essentially talks about where are you on the spectrum of readiness to change. And so the barrier can kind of come up at any stage of that. You may be at a point where you don't really know that there's a problem or you don't think that there's an issue. And in that case, we call it pre-contemplative. Then you go into contemplative and you're like, maybe I do have some things that I need to address, but I may not be ready. And then preparation is where you're kind of getting yourself ready, but not ready to take that really big jump into stopping the use of substances and so forth. And it just kind of is this, continuum of readiness to change. Unfortunately, like I said, there could be barriers along that whole spectrum. And we see it a lot in your environment, stressors that present in an individual's life, their social support network, and the prevalence of, or potential use within that community, who you surround yourself with, essentially, and the ability to find a recovery community, just how we call it recovery-oriented care, because we want to make sure that the person who is wanting to maintain their recovery is really surrounding themselves with people who are like-minded in that way. And so the barriers can come in so many different ways. Pressure to use and triggers and all of those kind of buzzwords for, for addiction. But the key is really finding that recovery support and reaching out to receive some support and help while you're going through that process so that you can stay on that path of recovery.
Those stages of change that you brought up are so important and applicable to many things, I think, not just to substance use recovery. And
absolutely
brings back what you said earlier, I think, about the spectrum of mental health. I think it's so important that people realize it's not a toggle on-off switch for either mental health or substance use disorders, that everything's, a cycle, a spectrum like that. So thank you.
Absolutely. For sure.
So you're joining us during our April Bright Spot. April is, among many other very worthy causes, National Alcohol Use Awareness Month. And many experts do say that alcoholism is our nation's biggest health problem. What are your thoughts on that?
I am hesitant to say it is the biggest health problem, but it's certainly one of the most prominent that ends up creating a domino effect that affects so many other areas of your life. And a lot of times in the community, we talk about addiction in very similar terms, just like with mental health, about any other physical health issue. It is something that affects your daily life. You may have to take medication for on a consistent basis, and you treat it like you would. I see a parallel, or I hear a parallel a lot about diabetes, right? You got to test your blood sugar. Well, you might have to go and get medication-assisted treatment. You might have to, have follow-up doctor's appointments and things of that nature. Alcohol addiction is particularly challenging, I think, when it comes to treatment, because it is a very socially ingrained construct. The use of alcohol is ingrained in a lot of social environments. It's so prevalent, and the triggers for alcohol recovery, or the triggers for alcohol use for individuals who are in recovery, can be particularly, they're just very prevalent. So that I think is a big barrier for people. Plus, alcohol wreaks havoc on your body, just like drugs do. And we see a lot of people who have then co-occurring medical conditions, which that's another the term that we use in that aspect too. You're going to see a lot of people who have done damage to their liver or kidneys and things like that after long-term alcohol use. So I can see why people have mentioned this as being one of the biggest health issues in our nation, but I would also, walk that alongside other addiction issues like the opioid crisis, and that's not to detract away from other, medical conditions, but there are particular challenges and nuances within alcohol dependence that really deserve the attention and the support that they really need. So
you made a good point about the socialization aspect of alcohol use as well. So it's so socially acceptable, and almost more than that, it's in some situations not socially acceptable to decline a drink. People think that it's rude. They start to question you about that.
Absolutely. And then it comes down to too, there is the idea or the stigma that it's just one, or it's just a sip, or that type of thinking and that approach. And that's not necessarily the approach you take if somebody was like, oh, I'm diabetic, I can't eat that. There wouldn't be pressure to indulge or to participate. So there is quite a bit of tilted scale there, if you will. So,
yeah, absolutely. If you're just joining us, this is Bright Spot, your community connection to wellness, presented by CNS Healthcare. We are speaking with Cate Spinney about substance use disservices, and April being Alcohol Use Awareness Month. Cate, going into some more actionable items for our audience, if somebody is looking for help, they have a family member that maybe they're worried about, how would you suggest they approach that person, or what are some resources that they could turn to help?
So if you are somebody who feels as though you might have a issue or a challenge with your alcohol or other drug use, I would encourage you to educate yourself and start researching what that may look like. Again, we talked about a spectrum, and everybody's spectrum is different. The, binge drinking may be different than the standard, alcoholic perspective that what media and other things kind of push out into the community. So just start looking around for resources, start evaluating how it may be impacting your life. Are you seeing things that may be affected because of your alcohol or other drug use? And if so, then, let's start talking about that. You can reach out by visiting the SAMHSA website, which is the Substance Abuse and Mental Health Services Administration, SAMHSA.gov. It has an incredible library of resources that are available, literature, and other support groups. There is a toolkit too to be able to do a questionnaire or an inventory. And that's also something that you can do at CNS's website at cnshealthcare.org to be able to take a little screening tool to determine whether or not the services may be helpful for you. That's also true if you have a family member, friend, or colleague that you feel as though may be struggling with alcohol or other drug use. In that case, it's a little trickier, but you are taking that first step by being somebody who cares and somebody who wants to see better and or change for your loved one. And that's the first step. With that, I would say having conversations and approaching people, whoever they are in your life, with love, support, and open-mindedness is critical and key in having supportive and constructive conversations about their alcohol and other drug use. Each person is an individual, and you can't necessarily come up with a script about how to talk to somebody about alcohol or drugs. But if you're seeing and you're concerned, it's likely that person has felt those feelings also. And being able to name it and talk to that person, letting them know that you have love and support for them and you're willing to, provide that on the ongoing basis is really the initiator for change. So my recommendation or my advice would be just kind of start the conversation and know that if that person isn't ready for that conversation, you'll know. But it's also, I would say, don't give up.
It's always good advice. Appreciate that. I hear a lot about Narcan these days as another tool. Can you tell us what Narcan is, what its goals are, and where it can be found in the community?
Absolutely. Narcan has been one of our best resources or tools in combating the opioid crisis because of the prevalent overdoses and deaths that have happened over the past, we're seeing it rise every year, but I would say over the past 5 years or so. If I could just give some context to it, I would say that fentanyl, which is a very potent, very inexpensive way to spread out the use of heroin and or other opiates, is also finding its way into other drugs as well. And it's really important to be prepared for that in any situation. Narcan is a tiny little nasal injector, and it really basically is just like a little nose spray. It's a one-dose thing, and you deploy it into that person's nostril to help decrease the effects of the overdose or the opiate that person has ingested. The Narcan may be needed to be used more than one time and is something that you will definitely want to use in conjunction with calling 911 and getting other, medical emergency resources. However, it is something that is life-saving. So if you have somebody that's close to you or just want to be a diligent community member, having a dose of Narcan on you in your car, at your house, is always an important way to be able to support the community. And being able to have that on hand could mean the difference between life and death.
How can someone get trained on Narcan or get their own little
Absolutely.
bottle of it?
So the health department in every single county throughout Michigan supports Narcan training. There is Narcan training through CNS Healthcare as well. And we have been diligent about making sure to distribute Narcan widely throughout the community. We are very passionate about harm reduction strategies, which means that we, like I said, support any steps that would help a person move towards recovery, even if they're small steps. So we have both Narcan and fentanyl testing strips available at all of our sites, and many of our case managers and our community-based staff are equipped with them in vehicles, and you're able to get that equipment and or those tools through a CNS Healthcare staff person. So feel free to bring that up to any case managers or any of your points of contact through CNS, and check out our website and or your health department and Michigan Department of Health and Human Services for Narcan training and Narcan supplies.
You mentioned fentanyl testing strips as well. How are those used to help in the recovery process? Or just in harm reduction?
Yeah, absolutely. So fentanyl testing strips are a little bit controversial. And the reason is that it's intended for a person to use prior to using drugs to test their drug for fentanyl or for the presence of fentanyl. The reason that we encourage the use of this is because as somebody continues along that spectrum of stages of change, as we had talked about before, maybe they're not quite ready to move into the action phase of recovery where you start your process of stopping using alcohol and drugs. However, as they're contemplating and they're preparing for that step and they're continuing their use at whatever level that is, that one time, that one use could mean life or death. And it's really important that individuals are aware of what's in all of the things that they're ingesting, regardless. And fentanyl testing strips really are the opportunity for a person to know what they're putting in their body. Because oftentimes, especially with street drugs, you get what you get, and you don't necessarily know what's in there. So it's very likely that when you're, taking an illicit substance, there could be fentanyl and you don't know it. And again, that's true for cocaine, crack. It's true for, methamphetamines at this point. It is so widely spread throughout the illicit drug community that it's important to be as diligent as possible. And in that harm reduction spirit, we want to make sure that we provide those tools as much as possible.
Cate, is there anything else you'd like to share with our audience about this topic, or some final thoughts to leave them with?
Recovery is possible. And I think that would be my biggest message. Don't give up on yourself or on your loved one, because although addiction is the devil, it's the devil in the details. It's the thing that it really has the potential to tear people and families and communities apart. There is recovery and there is change. And ultimately, it's important to keep hope alive, because at some point, that next step, that rock bottom, if you will, could be the catalyst for a change. And I've seen that so much in our work, and it's a beautiful thing. So if you or your loved one is struggling with alcohol or other drug use, please feel free to utilize the resources that we've attached to this posting and or on our website. And we are also here to support that journey for you and or your loved one. And we hope that we'll hear from you soon.
Cate, thank you so much for what you do every day and taking the time to share with us and the audience today. We really appreciate that.
No problem. Thanks for talking with me.
And to our audience, thank you for joining us today for Bright Spot, CNS Healthcare's virtual show. We hope you'll mark your calendars and continue to join us the first Monday of the month at 12 to discuss feelings, struggles, and finding one's way. If you have a topic that you'd like to hear discussed, please drop it in the chat or comment on this video. Remember to be a bright spot. You never know when a smile, a compliment, or a kind word can change a person's day. Have a great week.